I am Shelton Stringer, and I come from the United States to be a patient here at the Cancer Therapy China to undergo immunotherapy and undergo traditional Chinese medicine. So it began for me on April of 2010, in which that prior to that time I had no sense that anything was wrong until there was a very sudden change that I had an obstruction in my bowel, and I developed very severe abdominal pains, was admitted that day into the hospital, and they did scans, and from those scans a very somber doctor came to me and indicated that we're going to get you admitted and have a team of specialists there for you because you have stage 4 colon cancer. And that was quite a surprise. And I had indeed from my general practitioner a team of surgeons and oncologists that did consult with me. It was felt that the best thing for me to do was to start immediately chemotherapy, and I did have 12 cycles of chemotherapy known as FOLFOX6, and at that time it was elected not to do surgery until after the chemotherapy to see what the chemotherapy would do. And fortunately for me, I had a fabulous response to the chemotherapy. Later, my oncologist would admit to me that I had one of the highest CEA scores in terms of my blood count of activity that he had seen as a patient. And that dropped very radically down from over 600 down to single digits before my surgery. Associated with that, because I had multiple tumors on my liver and the different lobes of my liver, as well as the primary tumor in the lower sigmoid area of the colon. It required a complex surgery, and I was brought in contact with a gentleman named Dr. Bilchek with Cedars-Sinai Hospital in Los Angeles. And whereas the surgeon that I had originally consulted thought that he could take care of the colon, but the liver he couldn't touch. It was too complex, and in his opinion, it would do no good. And so my oncologist said, well, we had great success with this surgeon. And so January 10th of 2011, a little more than a year ago, I had a double surgery of both colon resection and liver resection, removing most of the tumors except for one. One he did treat by laser ablation, and that outcome of that surgery was spectacularly good. The next PET scan that I had indicated that there was no activity, and my CEA score was within count was in normal levels. And so with that, I was free to pursue my life, and my life involves international travel, and so we started traveling again. But there was a concern about to maintain my health, that I would need to undergo chemotherapy. I continued that, and indeed my CEA count was starting to rise. There was no particular change in my CT scans, but my CEA was doubling within a couple of months, and that pointed to danger sign. So it had risen from single digits into double digits and was rising quickly. So he advised that we aggressively treat this again with another round of 12 cycles of chemotherapy known as Foxfury, together with Erbitux is the brand name. And he did describe that there would be a considerable amount of side effects that depending on how I reacted. Fortunately for me, perhaps it's my own temperament, my own body, I was able to manage those side effects quite well. I was able to work full time. Fortunately, I have a job that allows me to work at home as well as in the office, and so I was able to continue. It does have the main effect for me was general fatigueness and tiredness under the chemotherapy, and that did have success in bringing me back to a normal range again in my CEA scores. At which time he still advised that for the remainder of my life, from what he could offer, was to continue on with chemotherapy. And that, from the lifestyle that I choose to be very active with international travel, that was going to be problematic for me. So as part of my international travels, here to China, we were looking at the possibility of having chemo treatment while here in China, and we did explore that in my last one of my trips here in September, and that's how I came to know the Cancer Therapy China by an internet search. And we had emailed you, Sunny, and you had responded very graciously and gave us some basic information about the center and how it interacts with the hospitals here in Beijing. And so that, because of insurance issues, and it was decided for me, it was better for me to go home and fly back and have the treatment and come back. But that's when I was introduced to immunotherapy as a option for me, as well as having other types of therapies, traditional Chinese medicine, which because I have a Chinese business partner, he had kind of introduced me to the topic, and he's very highly educated, a PhD in engineering, and so I viewed that his advice and his counsel that to seriously look at more of an Eastern approach to my overall body health. And with that, I started interacting again with the Cancer Therapy China to look at the possibility of immunotherapy and to explore its benefits, if there was anything that would be negative for me. And in that regard, I wanted to do my own research to know if this was something very scientific. So the Cancer Therapy in their webpage does reference several professional papers. I read some of the abstracts to kind of understand the case histories here and how it's, and a little bit, my basic understanding is in physical sciences as an engineer, and so biology is a science that I'm not as accustomed to have a thorough understanding of, and then doing due diligence searches through the internet to find out, is there anything negative about this? If there's, and I could find nothing that would indicate that this wasn't a legitimate and very scientifically proven treatment to consider in the testimonials. One thing that was very helpful, the various pages of information on your website, and then when I came across the link to a Facebook page that you at Sunny had, that brought the more personal side of things, and some of the people that had written in and the various postings there, that also again gave me confidence to move forward with this treatment program. I wouldn't be here, I don't think, in this condition if I did not have the gracious support of my wife, who's been with me for 27 years, and she's been a gracious caregiver to me. My, as I say in Chinese, 我的太太, Patty. And she has been very much at my side to encourage me through this time. And then my mother. My father had passed away a number of years ago, but my mother was a has been a very strong supporter. She writes me a card. First, before surgery, she would call me every day, even to the point where it was getting a little old to get a call every day. Nothing really to talk about, change from day to day. But she would nonetheless write me a letter, a personal card, and send it in the mail, and words of encouragement, and to keep hanging in how proud she was of her oldest son, and those were words of encouragement that kept me going. And then the support of family and friends and church family, they all added together to give me a network. And also I have a gracious company too that I work for, and people that care very deeply for me on the company that I work with, and their support was helpful as well. Yes, I did discuss this with my oncologist on a number of occasions, introduced the topic of immunotherapy. He looked at the basic literature. He was familiar with it, not in great detail, but he was at least had introduced, and he was not discouraging, but his advice to me was that I do need to be aggressive in attacking this because the genes that cause the carcinogenic cells to develop are very smart, and they can re-engineer themselves and adapt to and become resistant to drugs. And so that because I had missed and skipped a cycle of chemotherapy associated with travel, he was kind of, it's up to me how I wanted to devise my own treatment program. But his words were to me at the time, don't rock the boat. You're doing good, keep going with it. So I continued through the chemotherapy cycles that he advised, and then his advice was, you need to do something to continue, and he suggested, yes, you could pursue immunotherapy. He would like to see kind of the reports, and he would continue to monitor me with blood and CT scans and see where it goes from there. He is cautious in regards that, advising that, to be realistic, that chemotherapy is probably still within something I will have to contemplate in my life, and that remains yet to be unseen forever, how long I continue with this. The DC-CIK immunotherapy, for me personally, has no side effects. Perhaps on the first day I felt just a little funny, but I couldn't really describe it. But there was nothing, and it may have been almost in my head, because there was really nothing I could sense or detect. I know that one potential side effect for some patients can be a low-grade fever for a number of hours. That never happened to me. I never lost a sense of energy. If anything, I've been, since chemotherapy, steadily been more energetic and feeling that I want to be pretty independent, and so each night and the other thing that's been great about this particular treatment program, because I do have a business here in Beijing and very busy at that, this was able to be administered to me on an outpatient basis, which I don't know how frequent that is, but I sense that that's not very often the case. And that I'm really grateful to have that ability of independent. The accommodations here have been great, but it is a hospital, and I have basically a home here in Beijing, and we're making it a home, and so that feeling of independence, that feeling of being able to go home, and just like it was for chemotherapy in the United States, to be able to go home and have a life the best that I could, even undergoing the therapy at that time. But immunotherapy has been no particular distraction to me. Actually, hospital care here in China has been very gracious. The nursing staff have been very polite and very good to work with. And for me, the special attention that you get here in China is perhaps a level of service, although there are very caring health care professionals in the United States. This special care, even at times when it seemed what I call over the top, or just even more than what I would expect or want, it was nonetheless very appreciative, and I do appreciate the staff here at the hospital, and that's made my stay here very pleasant here. While I've been here, with just only a fraction of the day, typically 4 to 6 hours each day. Based upon my experience now, because this is early, obviously I have to be intellectually honest, and I don't have the results yet, how the DC-CIK, and that'll be a number of months, but I have every anticipation that this is going to be a positive thing for me, and on that basis I would definitely recommend other patients consider this immunotherapy based upon what I've read, the research that's been done here, how the technology's been developed, and even the literature information that was passed on to me of this type of immunotherapy and gene therapy that was recent recipients of the Nobel Prize, all indicate that this is cutting edge technology. One of the things that my business partner here in China, he had a friend that was a doctor, and so he looked into it too, and he reported back, yes, this is good, this is cutting edge technology, and was real, because he was concerned that I wouldn't get into something that was just expensive and ineffective, and that's not, I don't think, the case for me. I think that much like myself, the journey that I made to come to this decision, they should, with consultation with their own doctors, together with the information that is available to search about this type of therapy, to understand it and to understand the real basic science or the principle behind it, as well as being able to talk to people that perhaps have either gone through the therapy or know about it, that they can get a sense of confidence that this is a good, viable treatment for cancer, and probably essentially most patients of cancer can benefit from this in some way. And based upon what I've seen and read, it would look like this is a treatment program that should be considered fairly early on, rather than at the very last resort above all things, the last option to grasp for. It should probably be considered as part of the program and with consultation with her doctor very early on. Since I had, for myself personally, since I've been in and out of China a number of times, there were a lot of things that, barriers that would prevent maybe other people from considering coming to China, which is, for me, as a Westerner from the United States, I've grown accustomed to life and the culture in China, although it's many times different, sometimes bewildering to understand. But having somebody like yourself and Angela and others that I've met over the last couple of months that can speak and converse in your native language, that gives a level of comfort and to guide you through the process, and know that you're being watched or you're being monitored in the sense, in a good sense of taking care and making sure that you don't get into harm's way. If you depending on what your stay is here in China, to guide you through a culture or the language barriers that do exist from non-Chinese speaking people, and so for me, I felt very comfortable with this. The doctors seem very what would impress me is when they review my medical file, they understood exactly the medical chemicals and were able to repeat that and to understand what the experience that I'd went through and the advice that I'd been giving, and kind of endorsed that and said and then suggest that this is what we can do from this point forward. I believe, based upon my experience with the Cancer Therapy Center, that immunotherapies and other medical technologies that they have to advance the treatment of cancer is a very worthwhile endeavor for other patients to consider and pursue and be encouraged to undertake.